Today, we're diving into a really fascinating story from the front lines of oncology. It's about a clever new way of looking at an old clue that's giving doctors a powerful new tool to fight one of the toughest cancers out there. And it all really boils down to this one huge question. For patients and doctors who are facing this incredibly high-stakes decision, what if you could know the odds of success before you even set foot in the operating room? Let's jump in and explore the breakthrough that's making this a reality. Now, to really get why that question is such a game changer, we first have to understand the sheer scale of the challenge we're talking about, and that is advanced ovarian cancer. And the numbers here, wow, they really paint a tough picture. We're not just talking about any disease, we're talking about one of the most lethal. Around the world, nearly 250,000 women are diagnosed every single year. And for those with advanced stages, the road ahead is incredibly difficult. For doctors, the holy grail, the ultimate goal, has always been to find a reliable way to know which patients are going to benefit the most from the standard aggressive treatment. And that standard treatment path leads directly to a really pivotal, high-stakes moment, a very complex and demanding surgery. So here's how the standard approach works. It's a two-step process. First, patients get what's called neoadjuvant chemotherapy, or NACT. The whole goal there is to shrink the tumors as much as possible. Then comes the big one, the interval debulking surgery, or IDS. This is where surgeons go in and try to remove every single visible trace of the cancer. Success at this stage is absolutely critical. And this right here is the million-dollar question that has just plagued oncologists for years. How do you know if that chemo is actually doing its job well enough to make that incredibly invasive surgery worth it? If you go ahead with the operation, but the chemo response wasn't great, you could put a patient through a really difficult procedure for very little benefit. It's a massive clinical dilemma. So to solve this puzzle, researchers started looking deeper into the clues that were, believe it or not, already there, kind of hidden in the patient's own blood. For a long time now, doctors have used a tumor marker called CA-125. Think of it like a little signal that the cancer puts out. So during chemo, doctors keep a close eye on this number. If it's dropping, hey, that's a good sign. It means the treatment is probably killing cancer cells. But here's the thing. It turns out that just knowing the level of that signal doesn't give you the full picture. And this slide, oh man, this just explains the leap forward so perfectly. The old way of just checking the CA-125 level is like glancing at your car's speedometer. It tells you your speed right now. But this new method, called the KELIM score, well, that's like calculating your car's acceleration. It doesn't just look at what the level is, it actually models the rate, the speed at which it's falling over time. It's measuring the momentum of the response to treatment. It's a brilliant idea in theory, right? But would it actually work in the real world with real patients? Well, a new study set out to answer that exact question. So to figure this out, researchers in China looked back at the records of 133 patients who had all gone through that standard treatment, the chemo followed by the surgery. And this was a really crucial test because it was the first time the KELIM score's power was being validated in an Asian population. The goal was pretty simple. Could this score, calculated during chemo, actually predict who would end up having a successful surgery? After digging through all that data, the answer they found wasn't just a maybe or sort of. It was a clear, definite, resounding yes. I mean, just look at this difference. For patients who had a successful surgery, and that means all the visible tumors were gone, the median KAM score was 1.20. But for those where the surgery was unsuccessful, it was way down at 0.71. That is not a small gap, folks. That is a huge, statistically significant signal. And what's more, the researchers were actually able to pinpoint a specific cutoff value. They found that a score of 0.925 acted like a magic number that did the best job of separating the two groups. And here is just how powerful that number is. Patients with a KELIM score above that 0.925 cutoff were nearly 5.5 times more likely to have a successful complete surgery. I mean, can you imagine? That gives doctors an incredible predictive tool to work with. But the good news didn't even stop with the surgery. A higher KELIM score also meant that patients lived longer without their cancer coming back. And what's most important, it also predicted better overall survival. Think about that. A simple score calculated from just a few blood tests was basically forecasting the entire trajectory of a patient's journey. Okay, let's look at the actual numbers here, because they are absolutely striking. Patients in that high KELM group had a median of almost 7 months longer before their cancer progressed.
And for overall survival, the difference was over 14 months. That is a massive difference in outcome, all predicted by this Kinetic score.
So what does all this mean for the future? Well, it means a powerful new tool in the clinic, and with it, a real sense of renewed hope for patients. You don't just have to take my word for it. The study's own conclusion says it all. This isn't just some interesting academic finding. It is a practical tool that can be used right now to help guide some of the most difficult decisions in cancer care. Here's why this matters so much. It completely shifts the paradigm. Doctors can now more confidently identify patients who are excellent candidates for that aggressive surgery. But just as importantly, for patients with a low score, they can maybe avoid a surgery that might not help and instead pivot towards newer, more innovative therapies. It is the absolute definition of personalized medicine. When you step back, the KELIM score is a brilliant example of using data we already have, but just looking at it in a smarter, more dynamic way. And it really makes you wonder, right? What other diseases could be unlocked, not by some brand new discovery, but by a new way of seeing the clues that are already right there in front of us?